by the Department of Basic Education, where Angie Motshekga did, of course, re-emphasize the fact that schools will indeed be reopening, that they are not closing at this time as was anticipated. We're now joined via Zoom by the General Secretary of the South African Democratic Teachers Union, Mugwena Maluleke, and the spokesperson for the South African Federation of Trade Unions, that's Trevor Shaku. Very good afternoon to both of you this afternoon. Thanks so much for being with us here on SABC News. Let me start with you, Mr. Shaku. Beginning with your reaction, please, to what was said by the Minister of Basic Education, that schools will indeed be reopening, that instead of closing, what will instead happen is that teachers will all be vaccinated. What is your response at this time from the South African Federation of Trade Unions?
It is a positive move that the Department of Basic Education has proceeded to prioritize teachers and all other staff in the education sector to be vaccinated, because from how things have been unfolding, the COVID-19 had pushed the education sector into a serious disarray in which learners had to rotate, and as a result, many had to adjust and to different and new methods of teaching, which were implemented through the rotation basis. But also, this has has a serious impact as far as the teaching and learning is concerned, because rotations had disrupted the routine and the various drilling which teachers do on daily basis. And as a result, teachers had to have learners this week and learners that other week. And in various areas like in Hamashashani, where Equal Education had reported that learners went to school once a week, which amounted to 4 times per month. So those were serious issues which had brought into light by the COVID problem. And as a result, the ramping up or the beginning of vaccination in the education sector would actually assist in ensuring that the problems of rotation are evaded and are averted, and as a result, normal teaching and learning can come to normal in the third term.
All right. Let's get word then from the South African Democratic Teachers Union. Mr. Maluleke, let's bring you in then. Your reaction this afternoon to what the Minister of Basic Education had to say. It is quite interesting that there is, of course, a plan to vaccinate 582,000 teachers and teaching staff and support staff. But, of course, the question does remain as to whether or not everyone will indeed want to be vaccinated. Quite an interesting point that was raised there by one of the reporters that on one hand it is voluntary, the vaccination process, but the fact of the matter is that there may be those who actually don't want to be vaccinated. Are you confident that a large number then of teachers and the support staff will indeed go through with the vaccination process? And really just your reaction then to what the minister had to say.
Thank you for the question, and good afternoon to everyone and to your viewers, and good afternoon to Trevor. Because I want to believe that Trevor has covered a few of these areas.
Sure.
Indeed, 442,000 out of 482 have said yes, we will take the vaccination. And clearly it is that we have to continue to motivate all our teachers and all our support staff, because they are frontline workers, and therefore they need more information. They need more support for them to be able to take that particular decision. Yes, of course, vaccination is voluntary. However, we want to say as a union that vaccination works. Vaccination is safe. And therefore, as the organization and the leadership of my organization, we have taken a decision that we as the leaders will be leading in the front in terms of taking the vaccination, because we believe that it will assist us to have a defense line for our educators as the frontline workers and so forth. So yes, we'll continue to talk to those who are hesitant and those who have received fake news. We will continue to counter misinformation and disinformation And some of these are said by people that are supposed to be respected in the communities and really talking against vaccination without really looking at the scientific facts around the vaccines and so forth. We are here today where we are. Most of us, we've been vaccinated for various pandemics or for various illnesses like smallpox, whether it's measles and so forth. We've been vaccinated, and therefore it is part of education, and the education sector as the one that builds a nation, as the teachers, we need to continue to be giving factual information, scientific information around the vaccination. We welcome the fact that the 14 days will be used for that, and we would have loved that our teachers would have been vaccinated by April, thanks to the Minister of Health and the Minister of Education, who also joined me at the UNESCO level, where we were advocating globally that the teachers must be in the front line and they must be also be prioritized for this particular vaccination. And indeed, we are happy that finally we can see our teachers being vaccinated and therefore be able to rescue the education from this particular impact of the pandemic that it has caused. I mean, we're talking about a possibility of a generational catastrophe where competencies and skills by learners might not have been covered. I mean, imagine a grade 1 learner who is not going to be able to read at grade 2.
Mr. Maluleke, just to continue, though, on what you spoke about in terms of the disruptions, I'd like to carry on with you. I mean, the Minister was talking about the difficulty in balancing teaching and learning with health concerns of the country during the pandemic. And I know that there have been some parties, some political parties who were vying or hoping that, schools would, in fact, remain closed at this time. Let's talk about this difficulty when it comes to, on one hand, having to deal with the issue of, teaching and learning. And as you rightly say, children in grade 1 do need to see their teacher there present in front of them teaching. But then we're also, at the end of the day, dealing with this pandemic. I want to talk to those difficulties we've had in terms of playing this balancing act, which we're essentially having to continue to do at this time. And some might see this as some kind of a risk that we're taking.
Thank you for the question, indeed. And I have refused to answer that particular question, especially if it comes from political parties, because for me, it is that political parties are about electioneering and rather than to be concerned about our lives. And sometimes I don't want to waste my time really responding to such things, because at the end of the day is that we are there to be able to talk to each other at the end of the day, rather than to be threatened and be given some kind of ultimatums as if we're living in a country that has got no law, no constitution, and so forth. So for me, my organization believes that we're building a nation. And when we build a nation, let's talk about the health and safety of everyone that is in our schools, everyone that is in our communities. And therefore, we must be able to say, how do we do that particular balancing act? That balancing act is very simple. It is that when we are confronted with a pandemic like this, we need each other. We need solidarity. We don't need somebody to come and threaten us and intimidate us. We need solidarity. And standing in solidarity would be to say, which schools are now affected and how do you deal with them? And globally speaking, it is that every hotspot will be the one that is going to be shut down. And when the hotspot is shut down, the schools in that particular hotspot will be affected because we want to reduce mobility of people, because the virus is only mobile when people are mobile. And that's what you do. And when there is a need for the schools to really close, generally all of them, we talk with the minister. We did that last year and will continue as the union. When we spoken about this particular issue and having received information, we will be able to engage the minister continuously to then say, we believe this is the time for us to reduce the mobility, to reduce the volume of people moving around so that we're able to deal with this. But let's remember that the transmission is happening right in the communities, right where we live. And therefore, if we don't follow the non-pharmaceutical intervention in terms of wearing our mask and washing our hands and making sure that we sanitize, we will not be able to defeat this particular pandemic. It is not how much you speak rhetoric or how much you threaten the people that can end the virus. What will end us in this particular situation is when we are pledging solidarity with each other, wear the mask as a person, take personal responsibility and wear your mask wash your hands, make sure that you don't have visitors, stop the parties, and everything that is going around here is the one that is causing a problem, because the virus is not only in the schools, the virus is in the workplaces, it is everywhere else, it's at home and so forth. Some of us have lost our family members who are not teachers, and they got it when they were at home. So we need to be very careful around this particular issue, because here we're talking about something that is very sensitive, and therefore we need to be able to engage with each and everyone. But I don't take threats, and I don't want to be part of a country that is promoting and giving credence to anarchy and intimidation and threats. I don't believe in those things.
Mr. Shaku, let me bring you in here. In terms of your union members, let's talk about their reactions in terms of vaccination and possibly what they then will say with what the minister has kind of given information on when it comes to vaccines. I heard Mr. Maluleke saying that, you know, that there will be encouragement from union leaders to certainly push or encourage teachers and support staff to be vaccinated. But I really want to stick to the issue of those who are saying, I don't want to actually be vaccinated. Is there certainty that they won't be isolated? I heard Mr. Maluleke talking about those who've been reading fake news, for example, or those who have been discouraged to vaccinate. But there was an interesting question that one of the reporters was asking, and that it does seem as though it's almost forcing teachers to be vaccinated. If one says, as the minister said, that those teachers who are working remotely will be forced to come back to work, will be forced to come back to school. I mean, surely that also does sound as though one is being forced to vaccinate. So can we get some sort of certainty that people won't be isolated if they feel that they don't want to take the vaccine? I mean, how will you be dealing with it in terms of your own union members?
Thanks, Flo. Firstly, the South African Federation of Trade Unions had taken a resolution and had in the past been encouraging members of society to ignore the fake news which have been going around and trying to scaremonger the people from taking the vaccine. And we are at the point where the third wave has approached and is apparent now, but most importantly, that there are even cases of number of COVID-19 cases in schools which are rising. We've seen in Northern Cape, we've seen in Gauteng and in Free State. So we, as the South African Federation of Trade Unions and the teachers union affiliated to the Federation, will be encouraging our teachers to take the vaccine, because it is important at the current moment to have comrades having a form of protection against this virus, most importantly, not only to save their lives, but also to save those of their families. And especially because at the current moment in this country where the COVID-19 rollout plan is so low and is moving at a very low pace, it is important that this opportunity created in the education department should be grabbed with both hands by educators and other non-teaching staff in the education sector to ensure that they are able to increase a number of those who are vaccinated, but for their own families and for the protection of their own families, it is important for them to do so. Whilst it is voluntary for them not to accept or not to accept, or to be vaccinated or not to be vaccinated, it is also important for us as a federation to encourage all workers to be able to vaccinate and take this opportunity.
Yeah. Just as we close off our conversation, Mr. Maluleke, let me bring you in one more time here. What is your message then to, and I've been looking at social media, and there have been quite a few parents who are actually quite afraid to take back, their children to the schooling environment when it comes to putting them, at risk with those teachers. I mean, we know that the vaccination process is set to start, 14 days being given to that. What's your message then to those parents who are perhaps a little bit concerned or very concerned about bringing their children back to schools, who are saying, look, I'd rather just keep my child at home and carry on remotely? I mean, what would you then say to that?
Briefly, is that there are standard operating procedures that are being used for the parents who are not comfortable to bring their children back to school to continue with homeschooling, and therefore they do apply. And the Department of Education has a responsibility to ensure that indeed those particular learners receive education there. However, it is important that we say that the standard operating procedures at the level of the school have got to be revised, because now we're dealing with a pandemic or a virus that is now affecting the learners. It was not affecting the learners, so that we're then able to bring some level of confidence in the parents so that they can bring their children to school, because they are losing out. But I'm saying they have a freedom of choice to either apply quickly to the department for them to be working at, learning at home, receiving work that they can. However, that in itself has got obviously some disadvantages. But of course, we cannot force the parents to really bring their learners or their children to school if they still have got fear. Ours is to continuously engage as a nation, engage in educating each other, so that we are able to say, once there's vaccine, let's grab it, like Trevor is saying, let's grab this opportunity and say to the parents, now that we have got a line of defense, let's use it to ensure that we improve the time for teaching.
All right. Well, thank you. Let's leave it there then. Thanks very much to you, Mr. Mugwena Maluleke from the South African Democratic Teachers Union, as well as you, Trevor Shaku, from the South African Federation of Trade Unions. Thank you very much to both of you, gentlemen. Much appreciated.
Thank you. Thank you very much.
All right, that is a reaction then from two of our teacher unions there on the back of the announcement by the Department of Basic Education, where Minister Angie Motshekga did mention that schools will not be closing, and that instead there will be a vaccine rollout for all teachers, regardless of whether it is public schools or private schools, regardless of age. There will be a vaccination process that is voluntary, taking place from the 23rd of June. That's next week, Wednesday, and will roll out until the 8th of July 2021. An expectation that 582,000 teachers as well as support staff would then be vaccinated, or rather they're hoping that that number will indeed be vaccinated. And the minister encouraging everyone in the sector to indeed get vaccinated. And of course, we heard that while we're talking to the teacher unions, that 5 teacher unions had in fact done a survey about who would and wouldn't take the vaccine. And at the moment, it is said that 76% of teachers have said that they would indeed take the vaccine. So that is the briefing then. A lot of people really have been, a lot of parents, of course, concerned about what's in store for us in terms of schools opening. So there you have some of your answers. Let me give you an update then of those numbers as they sadly do come in of COVID-19. Over